Hello everyone, in this video we are going to discuss about the ligaments of hand, anatomy and clinical significance. First is collateral ligaments. These are generally found at the metacarpophalangeal joints and also in the proximal and distal interphalangeal joints. As you can see here, it is seen in the metacarpophalangeal joints and also proximal and distal interphalangeal joints. So these function as stabilizing the joints laterally. So they prevent the side to side movement, and these are taut in flexion and lax in extension. So whenever there is an injury, they cause joint instability. The main clinical significance is gamekeeper's thumb or skier's thumb. It is an injury to ulnar collateral ligament at the first metacarpophalangeal joint. So this is the first metacarpophalangeal joint. Whenever there is in here, as you can see, this is the metacarpophalangeal joint. Whenever there is an injury to ulnar collateral ligament, it causes gamekeeper's thumb or skier's thumb. So in collateral ligaments, whenever it is present laterally, it is called as radial collateral ligament. If it is present medially, it is ulnar collateral ligament. A damage to the ulnar collateral ligament causes gamekeeper's or skier's thumb. Next is volar or palmar plate. It is a thick fibro cartilage present at the palmar side of all these metacarpophalangeal joints, proximal interphalangeal and distal interphalangeal joint. These prevents the hyperextension. The clinical significance is volar plate injury causes joint instability, and this is generally occurs in sports injuries. So next is the deep transverse metacarpal joints. So these are these joints, the metacarpal joints. So these and it is called as deep transverse metacarpal ligament. So it is present between second to fifth metacarpals. In first metacarpal, it is absent. It allows the flexion of fingers together, so it helps in clawing the fingers together. Except the first metacarpal, all the rest of the four fingers we can claw together because of this deep transverse metacarpal ligament. Next is flexor retinaculum or transverse carpal ligament. It is present in the roof of a carpal tunnel. It attaches pisiform and hamate to scaphoid and trapezium. Scaphoid and trapezium are present towards the thumb side, and pisiform or hamate are the carpal bones which are present towards the little finger side. So clinical significance is thickening of this causes carpal tunnel syndrome, which causes median nerve compression. So this can need any surgical release. Next is extensor retinaculum. It is thickened fascia on the dorsal wrist, holds the extensor tendons in place. So Querion's tenosynovitis can cause, and this is overused. So we will see detail about the flexor and the extensor retinaculum. Flexor retinaculum, here that superficial to the retinaculum, these are the structures which are passing. That is palmaris longus tendon, palmar cutaneous branch of the median nerve, and ulnar nerve and artery in the Guyon's canal. Deep to the retinaculum, that is inside the carpal tunnel, median nerve, FDS, that is flexor distorum superficialis, flexor distorum profundus, and flexor pollicis longus. These are the structures which passes. So deep to the retinaculum is median nerve, that's why it will be compressed whenever there is carpal tunnel syndrome, and superficially ulnar nerve and artery will pass. Next is extensor retinaculum. Here it is divided into 6 compartments. First compartment, abductor pollicis longus and extensor pollicis brevis towards the thumb side. And second compartment is extensor carpi radialis longus and brevis, both structures. Third compartment, extensor pollicis longus. Fourth compartment, extensor digitorum and extensor indicis. Fifth compartment, extensor digiti minimi, that is at the little finger. Sixth one, extensor carpi ulnaris. This is the most medial one. So coming to the significance of these tendons, whenever there is an injury to the collateral ligaments, as we saw, ulnar collateral ligament damage causes skier's thumb or gamekeeper's thumb. This ligaments helps in side support and will prevent the lateral movements. Next, volar or palmar plate, it will stops the stretching at the palmar side. So whenever there is any injury, there is jammer finger can occur. Next is deep transverse metacarpals. As we saw, it is present between second to fifth metacarpals, and these keeps the fingers together, helps in clawing. So whenever there is an injury, it causes claw hand. And next is flexor retinaculum, carpal tunnel roof. It causes carpal tunnel syndrome. Extensor retinaculum, Querian tenosynovitis. And radial and ulnar collateral ligaments, wrist side, these are access wrist side guards, and any damage to it causes wrist pain.